Hello everyone, I'm Dr. Sukrit from Wellmed Clinic. Today I'm going to talk about one of the important things in our life. We probably spend like 1/3 of our lifetime for it. It's sleeping. From my experience, I've seen a lot of patients who have different kind of problem about this. So I want to share with you about what people are concerned with these 5 questions I was asked the most. Question number 1. What can I do if I have difficulty falling asleep? I want you to find out anything that can be fixed. Think about the body, the mind, and environment. For your body, some common problems are heartburn, allergy, taking some medication like nasal decongestant, or taking caffeine, alcohol, or smoking. But sometimes it relates with more serious conditions like thyroid disease, abnormal hormone. For the mind, see if you have too much stress, overthinking, anxiety, or depression. And for environment, the ideal condition for sleep is dark and quiet. Question number 2. How to sleep better? There are many things you can do depending on the time of the day, during daytime, before bedtime, and sleep time. During the day, you should expose to sunlight, have enough physical activity, and exercise regularly. Drink caffeine only in the morning or early afternoon. Avoid eating or exercise too late in the night. Before bedtime, about 30 minutes to 1 hour before going to bed, you should lower the light, disconnect from all devices, and be relaxed. Listening to soothing music or reading a book is a good example. For sleep time, you should have a regular sleep routine. Try to go to bed and wake up on the same time every day, including weekends. If you really need to sleep late, I recommend you to wake up on the same time, but you can take nap to help you go through the day. Ideal time for nap is about noon to 2 p.m. with about 15 to 30 minutes. If you take nap longer or later than that, it may disturb your sleep routine. Question number 3. What can I do to compensate the lack of sleep? Sorry to say that there is no such thing. If you don't get enough sleep, you will have to face a consequence. It can be a short-term consequence. Everybody knows that you're going to be sleepy the next day. So it will get harder to concentrate on your work, and it may even be dangerous if you have to drive or working with some machine. For long-term consequence, if you don't have enough sleep for a long time, it may lead into obesity, high blood pressure, and this will lead into more serious problems like heart disease. But if you really cannot get enough sleep, I recommend you to at least take care of your health as good as you can. Have a healthy diet, include fruit and vegetable. Have enough physical activity and exercise regularly. You may do some hobby, practice yoga or meditation, and have your check-up to confirm that you are in a good shape. Question number 4. This question comes from some of my patients who have a different side of the problem. They have enough sleep time, but they will always feel tired the next day. How does this happen? To have a good sleep, it's not just about time. The quality of sleep is also important. Many medical conditions can compromise your sleep quality. It may be breathing problem like obstructive sleep apnea, allergic rhinitis, or asthma. Sometimes it's systemic problem like anemia, abnormal level of thyroid or sex hormone. Or it may be a nocturia that you have to wake up during the night to urinate. This can happen in diabetes or BPH, stand for benign prostate hypertrophy. If you have some symptom of this problem or you feel tired most of the day, you should consult your doctor to rule out this problem. And sometimes it's not just physical illness, and your doctor may have you do a sleep test, or sometimes talking with psychiatrists is beneficial if anxiety or depression is suspected. Question number 5. What can I take to help me fall asleep? You may take a sleeping pill if you are really needed and already discussed with a doctor. But do not take other medications just to have their drowsiness side effect, like in some cold or pain medication. Try to eat natural things that contain melatonin, tryptophan, vitamin B, and vitamin D. These can be found in fatty fish, milk, and nuts. Moderate amount of carbohydrate in your dinner may be helpful as well. And those are 5 questions to help you get a good night's sleep. Thanks for watching and see you later.